What if the United States was the safest place in the world to have a baby? In my experience on labor and delivery, I've seen two major problems. One is that sometimes we fail to do a C-section when it was needed, and the result is that babies are born with permanent injuries due to a lack of oxygen. The other problem is that we as OBGYNs get nervous after an outcome like that, and we do too many C-sections. Both of those are big problems, but they're both ultimately related to our fetal monitoring, which is inherently inaccurate. If you think about the way that we care for a patient in the ICU, or even the mom during labor and delivery, we know the mom's heart rate, blood pressure, we know her temperature, all these things that come together to give us a picture of how that mom is doing. For the baby right now, we just have the fetal heartbeat. Unfortunately, when a mom has a category 2 fetal heart rate tracing, which happens to 80% of laboring moms, it means that we don't know if that baby's getting enough oxygen. And that's a terrible spot because it leaves the patient and the OBGYN with no clear guidance about how to proceed. We're gonna have two approaches in this program. The first is that we're gonna develop a test that will be done on all moms when they come to triage on labor and delivery, and it will tell us that mom's risk for complications. Complications like needing an emergency C-section or like their baby going to the neonatal intensive care unit unexpectedly. And that will allow moms to choose the delivery site that is safest for them, and it will allow hospitals to plan their staffing to make sure that that mom has all the resources she needs. The second part of this program is developing a completely new way of monitoring the baby during labor and delivery. With this program, we'll develop 2 new sensors and then use AI to interpret those total of 3 sensors to really give us an understanding of how that baby's doing. Having this new sensor will allow us to deliver healthy babies, so we won't see these babies that are born with permanent consequences. And it will also mean that because we know exactly how that baby's doing, we won't have to do these unnecessary C-sections that put moms at risk. I'm Dr. Kate Arnold, and I'm a program manager at ARPA-H.